There have been more than 5,000 confirmed monkeypox cases in the U.S., and the demand for a vaccine is outpacing supply. According to a Washington Post article, no more shots are scheduled to arrive until October at the earliest. The Jynneos vaccine is the only one approved by the FDA. The Post says as many as 1 million high-risk men may be unable to get the two-dose vaccine for months. Dan Diamond authored that piece and joins me now. He's a national reporter for the Washington Post investigating health politics and policy. Dan, welcome back to the show. So you spoke with a federal official working on the monkeypox response who warns of a, quote, possible vaccine cliff in coming weeks. Give us a sense of how bad the situation really is and how much is it still isolated in terms of that high-risk population?
Lana, thanks for having me back. This is a bad public health situation that has been getting worse. There are more than 5,800 cases of monkeypox confirmed. The numbers actually went up tonight, and they're predominantly in gay and bisexual men. I have talked to patients who are still having trouble getting access to testing, getting access to treatment. You mentioned the vaccines. The vaccine queue has built up even as more vaccines are not expected for some months. And then there are physicians who say they're still facing paperwork and bureaucracy when they're trying to treat these patients. So it evokes some of the same problems as COVID in early 2020. I should also say it's unlike COVID in that we now have thousands of cases around the US, no confirmed deaths linked to this outbreak. And we also do have these tools and treatments that we did not have in the early months of COVID.
Very important distinctions, Dan, but you're right. For many people, this does feel reminiscent of that. So tell us, how many monkeypox doses do health experts believe that we need right now, and how good of a job are they doing anticipating future needs?
Lana, I have asked that question of senior health officials. They don't give a clear answer, but I can tell you the CDC has targeted 1.6 million people that they want to get vaccinated. These would be people who have been exposed to monkeypox or men who are having sex with men and have had multiple partners in the past few weeks. That population, 1.6 million, 2 doses apiece, that's over 3 million doses, but we only have about 1 million doses, a little more, of Jynneos vaccines. So you can do the math. There are many people falling into that gap. I should say there's a second vaccine called ACAM 2000. It's older, it's targeted for smallpox, a related virus. Public health officials don't want to give out ACAM 2000. We have plenty in the stockpile, but it has accompanying risks that the Jynneos vaccine does not. So it's a fallback, but at this point, officials don't want to dip into that pool.
Thank you for helping that to make sense. So, Dan, also Biden administration officials say that they have acquired raw materials for 11 million potential doses, but it could take months to find a manufacturing partner. How much of this is a manufacturing issue?
That's a great question. So we do have those raw doses, and this is a very simple comparison, but imagine you're making the cake and you have all the ingredients, but you don't have an oven, you don't have a knife to cut the cake. That's sort of where we are with all this extra Jynneos. The supplies are there, but we still need to do what's called fill and finish. Lana, you fill up the vials with vaccine, then you finish with packaging and inspections. That could take weeks or probably months. U.S. officials I've talked to say they're looking for a manufacturing partner, someone who can help the manufacturer called Bavarian Nordic, which is just under amazing global demand. Everyone wants their Jynneos vaccines. So the U.S. is looking for a partner that can carry the baton on the raw material and make it into more vaccines in the coming months.
All right. Dan Diamond, thank you.
Thank you.